Hello dear viewers of this channel, I am Dr. Nevedrov, and today we will talk about a situation when we have good passive finger movements. Good passive finger movements when we help of other hand fingers to touch the palm, but we unable to achieve active movements. I mean the situation when we unable to grasp our hand into fist and we unable to take object tightly. We lack of good, powerful grip. And today we will talk about the reason for this and how to fix it. In fact, is that the dominant role of active flexion of the fingers into fist belongs to the muscles located in the forearm, deep and superficial finger flexion, which are attached to the middle and distal phalanx of the fingers. In order their energy to be transferred from forearm to fingertips, the energy must pass through the tendons, long tendons, to the phalanx. Energy must be transferred to the phalanxes. In order for this to be transmitted, firstly, the tendons must slide freely through the special channel sheaths in the finger. Secondary, our dynamic stabilizers of the wrist joint should work well, because if our wrist joint is not stable and the muscles stabilizing it are weak, we unable to bend our fingers into fist. We get this in extremity when the radial nerve palsy, for example, this situation. And thirdly, the stability of metacarpophalangeal joint is necessary, provided by short muscles of hand and extensor muscles of finger. These muscles provide the stability of metacarpophalangeal joint and helps to transfer the energy of finger flexion muscles to middle and distal phalanx. If we don't have this stability, we get poor flexion of fingers, and accordingly we don't clutch it into fist, but we have this situation, this finger flexion. What needs to be done for this? What should be done in order for tendons slide freely in fibrous sheaths? The first is so-called transverse massage of the tendons passing through the fibrous sheaths. Let's say we consider of the index fingers. We put two fingers in the base and performed transverse massage of this zone 60 times. Remove skin, then relax. Remove skin, then relax. Remove skin and then relax above the tendons sheaths. We don't rub the skin. We provide tissue mobility in the area of fibrous sheaths. Repeat 60 times. When we move fingers to the middle and proximal phalanx and also massage the tendon for 60 times. Massage the tendon 60 times. Then we put fingers on the bases of distal phalanx and the middle phalanx and also do 60 repetitions. 1, 2, 3, 4, 5. We don't rub the skin. I repeat that. We don't rub the skin, and we move the skin above the tendon sheaths. Move and relax. Move and relax. Move and relax. After that, we performed so-called block exercises. Block exercises are one of the most important elements for ensuring the sliding of the tendons in the sheets. What are we doing? With our middle phalanx fixed and proximal interphalangeal joint blocked, we flex and extend the distal phalanx with our tendons, with the power of our muscles. Usually we do 10 reps in one set and hold for 20 seconds in static mode. There are 3 such sets. Then we kept our proximal phalanx fixed and performed flexion and extension of the middle phalanx. Also, we do 10 reps in one set and fixation for 20 seconds in static mode. At some point, in order to apply maximum effort, we can perform 5 reps, but with maximum effort, with maximum stretch, and hold for 5 seconds in static mode. 1, 2, 3, 4, 5, and hold 5 seconds. 1, 2, 3, 4, 5, and hold the 5 seconds. 1, 2, 3, 4, 5. The next requirement, in addition to the dynamic stability of the wrist joint, is the stabilization of metacarpophalangeal joint to make a fist. The leading role in the stabilization is given to the short muscles of hand, the interosseous muscles, and extensor muscles of fingers. To train them, we do following exercise. We deviate the little finger 10 times. Then we deviate the third and fourth fingers 10 times. Then we abduct the index fingers 10 times. And 10 times we collect the fingers in the pile and then spread them. Weighting can be added if necessary with elastic bandage. We spread our fingers 10 times. There are also special devices for training this movement. They also can be used like these expanders, and we perform 3 sets of 10 reps to train the short muscles of hand and train the long extensor muscles of fingers. On average, after some weeks of training the veriform and interosseous muscles of long extensor muscles of fingers, we achieved full extension of fingers. It's very important to make fingers fully extended at the metacarpophalangeal joint. If this does not happen, we can use this kind of stretching. With fixed wrist joint, we stretched the veriform and interosseous muscles for 60 seconds so that our fingers are well extended in metacarpophalangeal joint. When we have achieved this fully extended fingers in metacarpophalangeal joint, we can train the flexion in proximal and distal interphalangeal joint. These are hooks. There are hooks. 1, 2, 3, 4, 5. That is important to keep an eye on. This is important to make sure that fingers don't flex like this. so that our powerful flexion do not drag the fingers here in the palm. First, we must learn to make true hooks in position with stabilized metacarpophalangeal joint. Once we learned how to make these hooks, we can add the following component in this exercise. When we made these hooks in extended position of metacarpophalangeal joint and bring the fingers in flexion to the fist. Bring the fingers first in hooks and then the fingers into fist. Bring the fingers in hooks and then we bring the fingers to the fist. We made 3 sets of 10 reps of these exercises. What else can be done to ensure a hard grip on clenching fist? Let's say we have been working out for several weeks and we can already grasp a bottle tightly. Let's add an exercise. At least 10 times we try to wrest this bottle from the hand that are mobilizing. 3 sets of 10 reps. Then we worked for a few more weeks and let's say we can already tightly grasp the rolling pin. We performed the same exercise with rolling pin. 3 sets of 10 reps. Further, we have worked and we can already grab the narrower tube. 3 sets of 10 reps. We learned to grip the tube tightly and we can move on pencil or a bolt, an object of smaller diameter. Bolt grip, 3 sets of 10 reps. So gradually we increase the grip and grasping stress of the finger. How to stay motivated? The thing is, it takes very long time to achieve active finger movements. It usually takes a few months of hard daily work. Keeping track of results helps keep you motivated. We can flex our fingers before exercise and measure by ruler its distance from palm. For example, the third fingers works worst for us. Measure the distance before practice. Now, for example, we have 5 centimeters, and afterwards we have 3 centimeters. Great! So we have been doing well. 2 or 3 weeks have passed and we already have 4 centimeters before exercises and 2 centimeters after. Excellent. A few weeks have passed and before sets we have 3 centimeters and after them our fingers touch the palm. Perfect. It's also important to know that there will be so-called swings. In the period of several months, you may find that fingers flex much better after exercise than before them. This is normal. Gradually tissues will stretch and these swings will decrease. In conclusion, I would like to say that these are really useful and effective exercises. They allow you to achieve a tight grip in many cases, but it's important to have them approved by your doctor because there are various situations. For instance, in early period after tendon suture, some of these exercises are strictly prohibited. Therefore, be sure to coordinate these exercises practicing with your doctor. If you have any question, write in the comments, and good luck with your rehabilitation and improvement of hand mobilization and movement. See you on the channel.